Hello, my name is Esmeralda Teo. I am an MO in Hematology Department of Singapore General Hospital. Today I am going to give you a talk on myeloproliferative neoplasms. Myeloproliferative neoplasms are a group of diseases caused by excessive production in the bone marrow. It arises from proliferation of a polyclonal hematopoietic stem cell. As a result of clonal genetic defects, there's usually overproduction of one cell line because of independence from normal cytokine regulation, leading to lack of negative feedback. MPN involves the three main myeloid lineages, with one lineage predominating. The World Health Organization classification of hematological tumors include 5 subgroups of myeloid neoplasms: acute myeloid leukemia, myelodysplastic syndrome, myelodysplastic or myeloproliferative neoplasms, myeloproliferative neoplasms, and myeloid or lymphoid disorders associated with hypereosinophilia. The incidence of MPN is 5 cases per 100,000, and there is an increased incidence in the older population, with 22 to 45 cases per 100,000. The 4 classic myeloproliferative disorders can be classified into BCR-ABL or Philadelphia chromosome positive, as in chronic myeloid leukemia, or BCR-ABL negative, which are polycythemia vera, essential thrombocythemia, and primary myelofibrosis. Patients usually are asymptomatic on presentation. They could have vague symptoms of dizziness, lethargy, vasomotor symptoms, or headache. Due to hyperviscosity from proliferation of blood cells, they can present with thrombosis, often arterial or in unusual venous sites. 3 to 37% have hemorrhagic complications, usually in the mucosa. Although considered neoplasms, they are not malignant, and their conditions have overlapping clinical and morphological features of tendency to bleed and thrombotic complications, and can transform to myelofibrosis and acute leukemia. Current treatments available target cytoreduction therapy, symptomatic treatment, and thromboembolic prevention, but unfortunately it does not alter the course of the disease. JAK2 is a tyrosine kinase receptor located in chromosome 9. Its role is in cell signal transduction. When the JAK2 receptor is activated by, for example, thrombopoietin, erythropoietin, or GCSF, the receptor activates intracellular signaling pathways, which leads subsequently to proliferation of the cell. It is essential for normal hematopoiesis. JAK2 V617F mutation is the most prevalent mutation in MPN. JAK2 mutation has been found in 97% of patients with PRV and 50 to 60% of those with ET or myelofibrosis. The mutation of JAK2 occurs in exon 14, changing valine to phenylalanine. It removes the inhibition on the active kinase domain, leading to the activation of receptors in the absence of cytokines like EPO, TPO, or GCSF, which leads to a gain in function and causes proliferation and survival of the cells. It is unclear how one mutation can lead to those 3 different disorders. Myelofibrosis is one of the myeloproliferative neoplasms. This blood film above shows teardrop poikilocytosis as the red cells squeeze past the fibrosis in the bone marrow. There is also leukoerythroblastosis due to release of immature cells into the circulation. Myelofibrosis is the clonal proliferation of myeloid stem cells, leading to ineffective erythropoiesis and dysplastic megakaryocytic hyperplasia. There is also a reactive fibrosis, as the fibroblasts are stimulated to produce excess collagen due to increased production of fibrogenetic cytokines by the clonal stem cells. This leads to ineffective hematopoiesis, which leads to compensatory extramedullary hematopoiesis in the liver and the spleen. Patients usually have nonspecific symptoms of breathlessness or lethargy from anemia. They may also have thrombocytopenia and leukocytosis. Patients may have fatigue, fevers from increased cytokine production, and weight loss. Clinically, they have massive hepatosplenomegaly, which causes the cytopenia, and symptoms related to mass effect, like abdominal pain. The prognosis is poor. Usually death occurs from marrow failure, thrombotic complications, portal hypertension, or heart failure. The treatment depends on the symptoms, the age, and prognosis of the patient. Some may have cytoreductive therapy, like hydroxyurea for high counts, blood transfusions for anemia, and splenectomies for splenomegaly. The only curative option is an allogenic stem cell transplant, but this is a limited option for most patients. Essential thrombocythemia is another disease under MPN. On this blood film there is increased platelet count and giant platelets. The diagnosis is based on platelet count of more than 450 times 10 to the 9 per liter, with no other cause of reactive thrombocytosis like infection. There is megakaryocyte proliferation, which is usually large with mature morphology, and there is usually no granulocyte or erythroid proliferation. In 50% of patients, JAK2 mutation is seen. Some patients with essential thrombocythemia are asymptomatic, but some can report bleeding complications like nose, GI, or gum bleeding due to dysfunctional platelets. They can also have vasomotor symptoms of headache, lightheadedness, night sweats, bone pain, peripheral numbness, erythromyalgia, which is the burning pain of the hands and feet associated with erythema. They can have increased thrombotic events as well. Clinically, they can have mild splenomegaly. The prognosis is usually quite good when they have normal life expectancy, but the prognosis worsens with age. The disease can progress to leukemic transformation or myelofibrosis. The treatment is usually symptomatic and to reduce the risk of complications. Hydroxyurea is a cytoreductive agent, and algalide has also been used which selectively inhibits the maturation of megakaryocytes. The use of cytoreductive therapy depends on the patient's age, history of prior thrombosis, and the platelet count. Low-dose aspirin is used to reduce the thromboembolic risk. Anticoagulation like Clexane and warfarin is used for venous thrombosis, and platelet pheresis is available for extreme thrombocytosis, hyperviscosity, or patients who are pregnant.